Good morning, everyone. So, starting this live with another amazing topic about neuroanatomy. So, I hope you all had a lovely weekend, and so let's dive in. What is the topic of this lecture? I'm going to start talking about the nuclei of posterior horn. Okay, so maybe what I can do here, I can use this old illustration. I'm gonna just add a few more details here and then I can work around. So I'm gonna use this thoracic one. Maybe the thoracic one. Okay, the nucleus of posterior horn. Let me just grab a pen here. I'm gonna grab actually a pen. Yeah, this one. This one. Okay. So it's important to understand the posterior horn. Okay, posterior horn. Okay, posterior horn. The posterior horn contains several distinct nuclei, and all these nuclei will play critical roles in processing sensory information. And they will be also responsible for relaying sensory signals to higher centers in the brain via specific ascending pathways. I can maybe leave this to talk in another video, but you already know that we'll have different ascending pathways and descending pathways as well. And what we can do here, how we can start? We can start adding. I'm gonna do here actually, because it's thoracic. Let's do this one. And then you will have to paint with another color because otherwise it will be hard to distinguish one from another. Okay, so we have 3 different nucleus here. Okay, 3 different nucleus. You can probably see the nucleus here. And I'm gonna use just one color to represent them. Okay, so now we have the 3 different nuclei in red. I'm gonna label this one, and I'm gonna call this the thoracic nucleus. Let me grab another one. This is thoracic nucleus. Okay, we have here the thoracic nucleus, which is located at the base of the posterior horn, extending usually from C8 to T3. Okay, and this nucleus in specific is involved in the transmission of proprioceptive and tactile information. Okay, another thing, this nucleus gives rise to the posterior spinocerebellar tract. Okay, I'm gonna talk about the posterior cerebellar tract in another video, but basically it carries proprioceptive information to the cerebellum, especially for coordination of movement. Okay, so this is the first one. Then we have the nucleus proprius. The nucleus proprius is this one, the second one. Let me just label 2 here. This is the nucleus proprius. And if you want to watch the full video, will be later on my YouTube channel, okay, which is the same name of my TikTok account, nucleus proprius. Why is so relevant to learn this? Why is so important? Maybe you can answer me. If you're working with massage, yoga, Pilates, if you work with Tai Chi, Qigong, Chinese medicine, osteopathy, chiropractic, if you are a nurse, maybe a biomedical, maybe you are just a researcher, maybe you are a physician. Why is so relevant to learn this for you, in your opinion? Okay, so the nucleus proprius, which is this one, is situated in the middle portion of the posterior horn, and this nucleus will process the wide range of sensory modalities, including touch, pressure, and vibration, and will contribute as well to the formation of the anterior spinothalamic tract. The anterior spinothalamic tract will mainly transmit pain and temperature sensations to the thalamus. Okay, so I'm pointing up because I like to visualize the brain to the top and the rest to the bottom. Okay, and then we have this one, which is the substantia gelatinosa. Let me label to this side, and this one is the substantia gelatinosa. Okay, substantia gelatinosa. So this one in specific is located at the tip of, or also the apex of, the posterior horn, and this nucleus is primarily involved in the modulation of proprioceptive pain. Okay. The other thing is gives origin to the lateral spinothalamic tract, which will also carry pain, temperature information to the thalamus for further processing. Okay, you already have a few structures here. And now let's move to the next topic related with this nucleus. Let me just write, because I forgot to write here. Nuclei of posterior horn. Okay, this is the nuclei of posterior horn. Now, I asked you before, why is so relevant to understand the nucleus? Well, once you understand the nuclei of the posterior horn, you will have a better idea when you, especially if you are a physician, you are going to have a better view for diagnosis, and also to manage neurological conditions that will affect sensory processing. And for example, the thoracic nucleus, this one. Once you understand that damage to the thoracic nucleus can impair proprioception and fine motor coordination, you are going to see the same signals in your patient. And these conditions will affect this region, okay? And it will, by reflex, result in difficulties with balance and gait, as well as will reduce the awareness of limb position. So when I ask you, keep your right leg at 90 degrees, or let's say move your right hip at 90 degrees, probably it will be difficult for the patient to do this, to replicate this action. Now, examples. Spinal cord injury usually can affect this area, and multiple sclerosis, especially inflammation and demyelination in the thoracic nucleus will interfere with proprioceptive signaling. Okay. Now the second one was the nucleus proprius. Well, talking about clinical impact, usually we dysfunction here. Okay, dysfunction on the nucleus proprius will lead to altered perception of touch, pressure, vibration, and what you will see is that patients may experience numbness, tingling, and even or abnormal sensations in the affected dermatomes. Dermatomes are structures that I will redraw and make a specific video another time, because I already did something here. Let me just see if I can find just to show you, but I'm gonna do another one. I think that I can improve this one. These are the dermatomes. Okay, areas specific of the body related with the spinal cord. Okay, so well, examples of conditions that might affect the nucleus proprius: diabetic neuropathy, which is a chronic hyperglycemia that usually damages the sensory neurons in the nucleus proprius, and this usually results in peripheral neuropathy, which will cause sensory loss. Yeah. We have another one called tabes dorsalis, which is a complication of syphilis, and affects the posterior columns, including the nucleus proprius, and it will lead to sensory ataxia and paresthesias. And what else? We have also this other structure here, the substantia gelatinosa, and this one I already mentioned is important to modulating pain signals, and dysfunction in the nucleus can lead to chronic pain syndromes or pain perception, altered pain perception. And an example of conditions that affect this area, chronic, we can say conditions like a fibromyalgia or complex regional pain syndrome, CRPS, usually involve dysregulation of pain processing in the substantia gelatinosa, neuropathic pain as well. Okay, damage to the sensory neurons in this region usually results in persistent pain states, quite often accompanied by hypersensitive to stimuli. So any stimuli will be very, very painful. And yeah, thank you, Cynthia. Now moving to the next one, that is the nuclei of anterior horn. Okay, the nuclei of anterior horn. I'm gonna use this one. Thank you, Cynthia. Okay, let me just oh, it's already here. Okay, I'm gonna do on this side because I'm not sure if I have enough space to label to this side. Well, not sure. No, I don't have actually. So let me just do this here. Don't fail. Okay, we have the nuclei of anterior horn, and here we have a few structures. Okay, the nucleus, of course. And what I'm gonna do, just to distinguish the anterior from the posterior, I'm gonna use the blue one. Where is the blue one? Yeah, this one. I'm gonna use this one. The good thing about the red, it's much more visible, I think, but I don't think that you will have a problem with this color. I hope so. Okay, so we have here this one, the lateral nuclei. So let me just label the lateral nuclei. And what I'm gonna do, this. Okay. The lateral nuclei related with these two here. These two nuclei. I hope you can see it. Okay, and then we have the central nucleus, which is this one. Okay, and then we have the medial nuclei, which is these two here. I think that I can write down here, medial nuclei. Medial nuclei. And just to make the illustration clear for you guys, I'm gonna highlight this one with blue, this one with red. Okay, medial nuclei, and this one is the central nucleus. Thank you for the support. Central nucleus. And then we have here the central nucleus, which is this one here, alone, but it's not alone. And then we have the lateral nucleus. The lateral nucleus. Okay, so about the anterior horn. This is the posterior horn. This is the anterior horn. So let me write down here. Anterior horn. Okay, we have the anterior horn. Let me just write nuclei. So the anterior horn of the spinal cord contains several nucleus, as you can see here, and they are primarily responsible for motor control. So remember, anterior horn, motor, posterior horn, sensory. And these nucleus here, they house the cell bodies of motor neurons, okay? And they will send signals to the skeletal muscles via peripheral nerves. And they are, as you can see, medial nuclei, central nucleus, medial nuclei, central nucleus, lateral nucleus. They are categorized based on their location. So as you can see by the names, lateral, medial, or central. Okay, the lateral nuclei. This one. Okay, this one, as you can see, is located laterally to the anterior horn. And these nuclei contain motor neurons that innervate the muscles of the limbs, both upper and the lower limbs. And they will be responsible for controlling voluntary movements of the arms, legs, and also associated joints to these limbs. The central nucleus, this one here, okay, the central nucleus is related with the cervical region of the spinal cord, and this nucleus in specific gives rise to the phrenic nerve. Okay, you probably heard about the phrenic nerve, but if you never heard about this nerve, I will ask you to follow me and keep watching my videos here every morning during the week, and sooner I'm gonna talk about the phrenic nerve. And the phrenic nerve, the phrenic nerve, and it will contribute as well with the spinal root of the accessory nerve. The phrenic nerve, okay, just to give you an idea of how important is this nerve. This nerve, the phrenic one, innervates the diaphragm, which is the we can say that is the primary muscle involved in respiration. And what do you think that will happen if this nerve is damaged? Do you have a clue? If it is involved in with respiration and innervates the diaphragm, damage to this nerve or to the central nucleus can impair the breathing. Okay, so the spinal root of the accessory nerve, innervates some muscles of the neck and shoulder girdle as well. But to talk about these branches of the accessory nerve, I need to talk only about the brachial plexus, and then I will cover all the structures, all the branches that comes off from the brachial plexus. But I'm gonna save another video to talk about this because it's complex. Yeah, it's not easy, but it's fun. Once you start to understand, you will start to make the connections. Okay, if I have a injury here, this will affect this muscle, or if I have something related with this muscle, might be affecting by reflex the nerve as well. So yeah, and then we have the medial nuclei, which is this one. And as the name says, is located in the medial aspect of the anterior horn. And these nuclei contain motor neurons that innervate the muscles of the trunk in general, including those involved with posture, movement, and the stabilization of the torso. So sometimes you might think, okay, I have a muscle problem, postural problem, but it might be related with something, let's say, deeper that needs to be investigated. If let's say the usual procedures used in manual therapy are not working, might be interesting to think about these structures. Okay, now clinical impact on the lateral nuclei. So dysfunction or damage to the lateral nuclei usually will lead to weakness or paralysis of the limbs, and conditions affecting these nuclei quite often result in loss of a voluntary control over the legs and the arms. And what I'm saying is on the muscles, okay, on the movement. Some examples: amyotrophic lateral sclerosis, spinal cord injury, poliomyelitis as well. They can affect the lateral nucleus of the anterior horn. The central nucleus, when damaged, can cause impair of the respiratory function, and usually due to its role, which is innervate the diaphragm. And conditions affecting this nucleus can be life-threatening, okay, if not promptly addressed. And some clinical conditions that can affect the central nucleus: cervical spinal cord injury, so trauma to the cervical region usually affect and damage the central nucleus, leading to respiratory distress, sometimes failure. Guillain-Barré syndrome, which is an autoimmune disorder that affects the motor neurons, including those in the central nucleus, okay? And it will impact the breathing. And the motor neuron disease, that are conditions like ALS, amyotrophic lateral sclerosis, and this will also affect the central nucleus, leading to respiratory complications. Now, the medial nuclei, when affected, okay, the patient might present weakness or paralysis of the trunk muscles, and this will affect posture, balance, and stability. Okay, and when I talk about stability, not is just a part of the stability, but overall stability. Okay, as examples of conditions that might affect the medial nuclei, we have a spinal cord injury as well. Okay, myasthenia gravis, which is an autoimmune disorder that affects neuromuscular transmission, potentially impacting the muscles innervated by the medial nuclei. And then we have the muscular dystrophies, dystrophies, which are the genetic disorders that weaken the muscles, okay, including those controlled by the medial nuclei. Yeah, and this is what I had to talk about the anterior horn. Now, the last part is related with the laminae of gray matter. Now let me think where I'm gonna use this drawing here. Okay, maybe I will do another one here. So let me do another one right here. Okay, and thank you for the support, guys. If you want to receive this drawing, if you can help me, it will be great. Just I will start to put some goals here, and then if you want to receive the video, have access to the video, and also the video will be on my YouTube. No, there is no problem with the video, but if you want the written part, the text that I use it to talk about these structures and the illustration, I'm gonna ask you at least for 30 coins. Okay, so this will help me, and then I can give the thing for you. I can give you the drawing, I can give you the text. Okay, so we have 1, 2, 3, 4. 1, 2, 3, 4. Then 5. Then 6, 7, 8, and 9. Okay, now what I'm gonna do? Let me just okay. 1, 2, 3, 4, 5. Oops. 6, 7, 8, 9, and then this one, 10. Okay, this one. Now, the gray matter of the spinal cord is classified in 10 laminae, as you can see here. Okay, the 10 are here, and this system provides a more detailed, systematic organization of its structure. Okay, which it helps to when you learn about the different communications that will be happening here during the transmission of pain, movement, motor and sensory information. As you can see, it starts from the apex of the posterior horn and goes all the way to the anterior horn. Okay, and the lamina 10, it's actually surrounds the central canal. Learn this will help you to understand the functional specialization of different regions. Okay, so this is the reason why I put this illustration here. Lamina 1, this one, is located at the apex of the posterior horn. Okay, this one here. Let me just do this. And this one will be related with pain and thermal sensations. I think that I'm gonna change the colors because otherwise we'll be too confused. So let me grab a few other colors here. Okay, next one is blue one. Lamina 2, okay, is just below the lamina 1. This one modulates pain signals and transmit them to the higher centers. Then we have the 3 and 4. The 3 and 4 are involved in processing sensory modalities, including touch, pressure, and proprioception. Also contains interneurons. Okay, so I need to sharp. Lamina 6, actually lamina 7. Actually 3, 4, 5, and 6. They all have the same function. Okay, then we have the lamina 7 contains motor neurons that will innervate the axial muscles. Okay, lamina 7. Don't forget to tap, guys, if you can. If you're not writing down, if you write down, just keep writing. But if you're free and can help with the taps, I really appreciate. Okay, lamina 7. Then we have the lamina 8. Let me just add with orange the lamina 8. Maybe this one. The lamina 8 is responsible for the limbs, the movement of the limbs. Lamina 9. Well, the lamina 9 contain interneurons that coordinate motor activities. This one. And then we have the last one, lamina 10, that surrounds the central canal. And this one contains cells involved in autonomic functions, especially related with the visceral organs. Okay, lamina 10. Oh, that's actually, the color is nice. Good. So, clinically talking about the laminae. Dysfunction on the laminae, in the laminae 1 and 2 usually leads to altered pain perception or chronic pain syndromes. Conditions usually affecting these regions often result in a hyperalgesia, which means that the patient might present increased sensitivity to pain, or allodynia, which is pain from no painful stimuli. Now, some examples of some examples that might affect conditions that affect these two lamina. We have chronic pain disorders, spinal cord injury, and multiple sclerosis. Lamina 3 to 6, lamina 3 to 6, yeah, usually when affected, the patient might present sensory deficits such as numbness, tingling, or loss of touch and pressure sensation. And usually may also impair proprioception, which means that the patient might present some problems with the awareness of body position. Conditions that affect these lamina, we can include diabetic neuropathy, tabes dorsalis, spinal cord compression. Then we have the lamina 7 to 9. 7 to 9, okay? Usually when affected, the patient might present motor deficits such as weakness, paralysis, or impaired coordination. Okay, so which means that the patient might present loss of voluntary muscle control. Some conditions that affect these three lamina are amyotrophic lateral sclerosis, spinal cord injury, or even polio. And then we have the lamina 10 that when affected, the patient might present some irregularities in heart rate, blood pressure, and also might present sweating and bowel bladder control. These conditions usually impact impacting this region actually, can lead to significant effects on internal organs, especially the regulation of the internal organs. And then we, about the conditions that might affect this lamina, we have the autonomic dysreflexia, okay, and also sympathetic and parasympathetic imbalance. So, which syndrome? In which lamina? Do you remember? I'm gonna be talking English because this video is in English and it goes to my YouTube channel. Autonomic dysreflexia probably is this one. This condition is one that usually occurs after high level of spinal cord injuries. Yeah, so it occurs after high level spinal cord injuries, where usually the lamina 10 is damaged. Yeah. So this is the video that I wanted to share. What I'm gonna do now, I'm gonna finish this live. I already put the time of the lives on my TikTok, so every Monday to Friday at 9:30 a.m. in English. So this video will also go to I will also put this video on my YouTube channel, okay? And afternoon at 2:30 UK time, and actually at 3 UK time, and 10:30, I think that is 10:30 Brazil. I'm gonna be doing another live. Yeah, so then it will be in Portuguese, talking about other topic, another different topic, Chinese medicine and health and reading. Okay, so thank you guys. I really appreciated your time here with me, and thank you for all the support, and I hope to see you this afternoon for another live, but then in Portuguese. So see you. Bye bye. Take care. On my YouTube in 1 hour. Okay?